Hi, I'm Carissa with Southern Homegrown, and I'm a doula, a nurse, and a midwife student. And today I just wanted to take a moment to go over, first of all, to congratulate you on this new journey that you're fixing to go down. It is totally awesome, and it's gonna be some kind of experience. Let me tell you, it's gonna be amazing. But on this journey, you have several different options, and it's always good to be prepared and educated as you go so that you know your choices and you know, risk versus benefit and things like that, and you can make well-informed decisions. So I'm gonna start a little series, basically childbirth education, dealing more along the lines of the natural route versus medicated birth, but we'll also touch on some of that as well. So, I mean, don't, if you're like, oh no, I'm not having a home birth, or oh no, I'm not having a midwife, don't worry about that. We're gonna still cover other things as well. So to start off today though, I'm gonna discuss the differences in care providers and your options that you have, as well as options you have as far as where you will actually birth, as far as the differences in locations and, the benefits and things for each. So first of all, your care providers, you have different options. Most everybody was like, okay, OBs, obviously. And, but you're not just, cemented into one certain, avenue. You don't just necessarily have to have an OB. OBs are generally trained in the pathology of pregnancy, and if you look up the word pathology, it is actually the study of disease. So pregnancy is not necessarily a disease. Pregnancy is natural. It's what your body was meant to do on its own. But don't get me wrong, OBs are there. They're surgeons, they're trained, like we said, in pathology. So if something is to go wrong during pregnancy, or you are high risk, or, anything like that, then yeah, OB is your route, OB, go with it. But then you also have other options as far as a midwife. And you may say, well, what is a midwife? Well, a midwife is somebody that is actually trained in the physiology of birth, the natural process of, how birth actually takes place, because it is a natural process. And you're able to, they're able to also be trained. They are trained also in emergency situations, NRP, which is neonatal resuscitation, for the baby, and CPR for the mom. Trained to know what to do in case of hemorrhage or anything like that, to be able to transfer. So they do have training in emergency situations as well, but they're more along the lines of a low-risk birth. But there are different types of midwives. There are CNMs, which is certified nurse midwife. They are originally nurses who have went on to train and specialize in midwifery. And they generally work in the hospital under the supervision of an OB, where some may also work in a birth center. And it depends on what state you're in, because in some states, a nurse midwife can actually do home birth, but I know in other states they are strictly limited to hospitals or birth centers. So it really depends on where you're located. It's a good thing to research the laws there. Then you also have like a certified midwife. That is someone who has had a bachelor's or a higher degree and has had some sort of non-medical training, but they decided to go this route. So then, they get their master's in midwifery, or, doctorate, or however they want to do it. But they didn't originally start out as a nurse, whereas a certified nurse midwife started out as a nurse and, So, but then you also have certified professional midwives, and this is the avenue that I'll be going down. Although I am a nurse, because I chose to, wherever I'm at, I would still like to be able to provide home births because we move a lot. So, you know, either way. But as far as a certified professional midwife, she is the midwife that is, she is trained medically as well. I mean, she knows the process, and she's went through, she's had an education of some type. She has used the apprenticeship model where she studies under another midwife for a while and trains under her and learns from her. She, it depends on what state you're in, because in some states, such as New Mexico, the CPMs are not necessarily under, they don't have to answer to a doctor, whereas like a nurse midwife or somebody else does. They're a standalone care provider. You know, they're able to write prescriptions if needed for certain things, just like a nurse midwife, but they're able to, you know, see you through your whole care just like the others. They're able to see you through preconception, after conception, you know, prenatally, you know, the birth and postpartum, as well as some well women visits as well. The certified professional midwife is able to actually come into your home and help you have a home birth, as well as, like I said, the birth center. And in some states, they can even work in the hospital. I'm not sure about New Mexico. Like I said, I just moved here, so I don't think so, but possibly in Louisiana. I'm not sure. Like I said, we would, you know, you'd have to look that up. But, you know, they provide more holistic and more wise women approach, I guess you would say, to maternity and, you know, your journey into pregnancy. Like I said, it's a natural process, and you have so many options. I mean, you just kind of have to research and choose for yourself what's best for you. And then I would also like to discuss your birth locations, options for that. You have the choice between a hospital, choice between a birth center, or at home. And at the hospital, we've all, you know, most of the time we know and we've experienced that. And, you know, most people know hospital, yeah. But then there's also the birth center. There's different kinds of birth centers. There's birth centers that are attached to the hospital where you, the midwives there, like I said, are under the supervision of the doctors, and it's attached and it's part of the hospital. You're kind of limited, and it depends on where you're at. Sometimes you're limited and you're not able to have a water birth. Sometimes you can have a water birth. Just does well to research your options near you for that. Then there's also the freestanding birth centers, which, you know, they're not connected to any hospital. They're operated on their own. And they're usually generally close to a hospital in case of transfer, but they're not a part of the hospital. They generally are more of the homey feel. Some are in homes, some, you know, and some may not be. It just kind of depends, but they give you more of that home feel, yet you're still, I guess, closer, you know, closer to the hospital, more controlled, more, make it put your mind more at ease that way. If you were concerned about maybe if your home's too far from the hospital and you still kind of wanted a home birth, but you're like, well, if we had to transfer, I live like 90 miles the middle of nowhere, kind of like we did when we lived in Mississippi, you know. So in that case, a birth center would be a really good option if you still want to have a more low-key natural birth. But yet still be relatively where you're able to transfer pretty soon and things like that. And then there's also home birth. It's your environment. It's where you feel safe and secure. It's makes it to where maybe during labor you're not afraid. you're more relaxed because you are in your element, and it helps you transition easier and helps with the whole process. But like I said, you have several different options. You have several choices as far as care providers and locations, and this is all like strictly, you know, up to you and what you're comfortable with. So like I said, you can always research it further, or, you know, email us with any questions or anything at info@southernhomegrown.com. Glad to answer any questions you may have. So just to recap, you have OBs, you have nurse midwives, you have certified midwives, and you have certified professional midwives. And your birth locations are hospital, birth center, home. So it's just really wherever you feel comfortable. And really later on, I'll go more into detail as far as the benefits of a calm, safe environment and how that affects your the different hormones and the different things going on in labor that helps the process along, and we'll discuss that later on in another video. But anyway, for today, we'll see you later. Bye-bye.